gosh, about 30,000 people in the U.S. suffer from a brain aneurysm rupture every year. A startling statistic. Knowing the symptoms are vital. Joining us is Dr. Daniel Cavalcanti, a neurosurgeon at Hartford Healthcare Eye Neuroscience Institute. Welcome.
Thank you. Good afternoon. Thanks for having me here.
You bet. All right, what is a brain aneurysm and what typically causes it?
Good question. So a brain aneurysm is basically the formation of a bubble on a vessel wall in the brain, and usually at the very weak point of those vessels.
What are the symptoms to be aware of when this happens?
So usually a brain aneurysm per se would not cause any symptoms unless it ruptures. So whenever it ruptures, usually it triggers the worst headache in life, nausea and vomiting, dizziness, and some patients actually can have some loss of consciousness.
Is family history a risk factor here?
Family history is a big risk factor. Indeed, 22% of patients with brain aneurysms, they have a strong family history. So whenever patients have two or more family members with brain aneurysms, we indicate do some sort of surveillance in the entire family.
Wow. Okay. How do you treat one? And I know you have to act fast.
So whenever we deal with a rupture aneurysm in the emergency room, we need to act fast, ideally in the first 24 hours. There are two main ways to treat a brain aneurysm. The main one, the most modern one, is what we call endovascular surgery, when we go through inside of the vessels, usually from the wrist or groin, and we fill the aneurysm with little metal coils. The other main technique that has been out there since the 70s is called surgical clipping, where we actually need to open a little window in the skull and clip the neck of the aneurysm with a little titanium clip.
All right, and this question, if you have one, will you have another?
There is a little risk of having a second aneurysm. Actually, multiple aneurysms are not very common. Most patients do have only one aneurysm, but multiple aneurysms can happen at a rate of 15%. And years later, patients can have a second aneurysm, unfortunately. That's why we still indicate surveillance for patients having an aneurysm initially.
All right, doctor, thank you so much for all the information.
You're very welcome. You have a good afternoon.
You too. And we'll be right back.